The Toyota Foundation International Grant Program Project Reports. Let's talk about empathy, conversations between the grantees from Grant Project Part 3, Health and Care. My name is Mori. Thank you for having me. I'm a member of the Department of General Medicine at Juntendo University School of Medicine, and I travel between Thailand and Japan frequently since 2010. In Thailand, I'm a member of the Faculty of Tropical Medicine at Mahidol University, and I'm the president of Global Medical Support, a nonprofit organization that works to connect Thailand and Japan. My name is Jun Sasaki of Yushokai Medical Corporation. I support home medical care in Tokyo. I'm an internal medicine doctor. I think connecting with society and community relates to the so-called happiness of those supported. For example, if there is nothing enjoyable, people will not take the trouble to visit the place. You mentioned that the current medical care and long-term care insurance systems could be bringing low level of happiness to those being supported.
支えられる側の幸福度が先生ちょっと低いんじゃないかっていうふうにおっしゃったんですけど。
The level of happiness is quite difficult to deal with. Is it really so that the level of happiness of those supported in Japan is low? How does it compare to other nations? How can we raise it? Those are all difficult to quantify. If we could quantify this, we could objectively say that happiness level increased through this and this efforts so that the report is correct. But I have the impression that happiness reports published by international organizations are not objective because they include a variety of indicators.
国際組織が出している幸福度の評価っていうのもいろんな指標が入っているがために、それが客観的でないような印象があるんですね。
そうですね。What makes people happy is highly individualized, but I think flexibility is one of the most important factors in dealing with individuality, and I don't think system can handle that. That is why I think it is very reassuring for a person to have someone nearby who understands their personality, values, view of life, priorities, and criteria for decision-making, and even if they are no longer able to voice their intentions well, someone who knows this person can judge the situation according to their wishes, saying, Mori-san is of such personality, so I'm sure he would want me to do this in such a situation. I think such a close social connection is very important prerequisite for people to lead a happy life. Looking at the World Happiness Report, Japan generally represents a beautiful circular-shaped diagram, but there is one sharply indented spot, which is the connection with society. When we conducted a survey on how many people are isolated, Japan ranked first in the world, with more than 14% of people living without talking to someone at least once a week. Looking at the composition of households, the elderly who live alone account for about 16% of the total currently, followed by the working generation who lives alone like us, accounting for 15%. Single-family households comprise approximately 30%. The next is elderly couple households, which are often isolated from the community, and there are quite a few cases of elderly couples rarely talking to each other. In fact, isolation has a lot to do with our happiness in Japan, and I think that the lack of social connection or having no such connection limits people's options, which are two factors that are preventing us from feeling happy.
一つ我々がその幸せを感じられない一つの要因になってるんじゃないかなというのはあるかなというふうに思いますね。
What I learned from the Thai community is what I call the nostalgic future. People support the elderly within large family and community, and even if the elderly don't have a family, nearby residents and neighbors take care of them, taking them to hospital, bringing them to food, etc. There are still places in Japan where elderlies are able to maintain their health through the communities, but I think we can learn more vividly from Thai community healthcare. In Japan, people used to live in large families, and even today, people in Okinawa do so. And I think people's health was maintained amid such strong social capital and connections with the local community. However, especially when it comes to urban areas, it is becoming increasingly difficult. When we create artificial social capital to some extent, such as community gatherings, they are often not sustainable and do not go well. This is connected to the earlier discussion of the hubs. Having a happy community and building hub is, of course, a social capital.
いうのはもちろんソーシャルキャピタルだと思うんですけど、その歴史
But in places where there is no such history, various efforts have been made to realize it, and I think it is difficult to do so by urban model.
難しいところがあると思うんですけど、これを
Kind of efforts do you think we should make as a solution to this problem?
どういうふうな取り組みが今後なされるべきだと思いますか。
ですね、私はずっと
I've been working for home medical care in the Tokyo metropolitan area for a long time, and I think it is impossible to create a community. Community comes naturally, and it is not something you can create. If you ask me if there is a driver to create a community naturally in cities, I would say that there may be a limited number of such drivers, but they are rather
とい
rare.
うふうに思います。で、例えばでも
But Taiwan and Singapore, for example, are big cities. Taipei has 7 million people, and Singapore is like a huge metropolis in itself. Everyone lives in housing complexes, but if you ask if there is no community there, yes, there is. For example, it's about the infrastructure, but there are places to eat on the ground floor and places where people can consult with each other about problems they may have. If you go to Singapore, you will find hawker center, a food court with food stalls. When you go there, you will find familiar faces and residents think, if I go out to eat at this time of the day, I will see this and that person.
でつながってるっていうのはあるんですよね。で、おじいちゃんおばあちゃん
Elderlies living alone and have nothing to do can spend the whole day at an inexpensive cafe-like place, eating porridge in the morning, drink coffee, eat porridge for lunch, drink coffee, eat dim sum in the evening, and after a drink they go upstairs back. Some people spend their time in such a way, and they might not need daycare. They could be surrounded by people who know them, offer to run errands like, Grandpa, would you like me to buy something for you? There are no you have to do this or that rules like in the old Japanese village societies, and if you don't want to get involved, you don't have to. I feel that in Taiwan and Singapore, people are very comfortable with such a loose connection.
みんながこう自然に
There is a word, ishokuju, literally meaning food, clothing, and shelter are essential for human beings. In this case, the Chinese character for I or clothing should be replaced with place because a place where everyone naturally gathers could be the key. I've studied several examples in Japan, and it seems irrespective of place, people feel that they would rather be with someone than being alone at home. They are hesitant to go to a new place, but can accept going to a place familiar to them. It seems to work well if they could gather at former schools or grocery stores that they used to go. So familiar place could be one of the key words.
キーワードになるのかもしれないなと思いますね。
When I go to Asian countries, people are so eager to know the situation of Japan's advanced aging society. But when I go over there and observe various things, I think what we are telling them may not actually be a good example for them. You mentioned earlier nostalgic future. We've gone through various things such as long-term care insurance, but we come to find that they're at a more cutting edge. We ended up discovering the idea of the nostalgic future. That's right. In terms of community, I often feel as if we are running a lap ahead, but in fact we are a lap behind when I go to Asia. In solving various social problems, do you have any advice on what strategies we should pursue to educate and train medical professionals, especially doctors, going forward?
戦略として進めていったらいいみたいな先生のアドバイスありますか。
そうですね。
Yes. I always think Japanese doctors do only half of their job. Many Japanese doctors think that their mission is to become a health insurance medical practitioner and provide healthcare services provided by health insurance. However, it is one of the social mechanisms to help people who are sick, and the medical practitioner's law does not require doctors to make a full commitment to this. Article 1 of the law says doctors should protect the health of the people, and are we protecting them? All we do is sit back and wait for the people to get sick, name the disease to those who get sick, treat them according to guidelines and protocols, and if they are cured, congratulations. If not, sorry. But the structure of disease is changing so dramatically. It could have been fine if doctors were just responding to healthy people involved in car accidents or infectious disease and saving their life. This is protecting the health of the people.
持ってるけど、ただその
However, the structure of disease has changed. We now have hypertension, diabetes, hyperlipidemia, arteriosclerotic diseases, dementia, and so on. They could be called sickness, but they're rather various physiological abnormalities appearing in the body as a result of changes in lifestyle.
ある一定のその
When a certain threshold is exceeded, the disease is given a name and the person visits a doctor. I think medical practitioners should try to make people not exceed this bar. The other thing I don't think we can do within the healthcare framework is to take an approach to help people maximize their potential of their natural physical functions and abilities so that they can live a better and longer life with as little illness as possible.
と思うんですね、我々。で、それってまあ
This does not mean that young people will not get sick. I'm including those who get sick to be able to live better after becoming sick too.
多分その人の病気だけ見てては全然だ
It is not enough just looking at the person's disease. The famous saying goes, don't look at the disease, look at the sick person. But it's not enough looking only at the person either. We need to observe their living environment, whom they live with, and what kind of community, and then provide comprehensive care. This is what primary health care should be about. Currently, we only provide health care, or rather, disease care.
ケアというかディジーズケアしかしてないんですけど、
保健所自
There
身
are trainings at public health centers, and medical care and public health care must be conducted in the same manner. This is especially true for home visits, but I always feel it difficult to educate people about this in Japan.
というのはずっと常々感じています。
It could be a good idea to visit Thailand to learn about this aspect through a community healthcare program, which would make people to feel the gap, which is a good
こ
thing.
とがあったりするところのこうギャップが生まれるのはいい反応なんじゃないかなとは思ったりするわけなんですよ。でそれを
By experiencing with society-oriented organizations creating leadership role models as you are doing, we need to think about the framework, programs, and content of such studies in Japan as well, including what to think other than disease and diagnosis.
にこう考えないといけないところはどういう大切なところがあるのかとか、そういうのもこう日本でこう何か勉強する枠組みとかプログラムっていうのをこうより考えて、その内容とかも考えていく必要があるんじゃないかなとは思いました。根本的
It may be more of a fundamental issue, but being properly connected will also be important for the counterpart countries
つ
too.
ながっているっていうのはよりもちょっと原本的な話にはなるんですけども、向こうにとっても大切なことではないかなと思います。向こうが
When they are in trouble, we can share idea from Japan or even from a personal level. If we are stuck and need idea, if there is a scheme to discuss and struggle together, even if we can't come up with an answer right away, the conversation will proceed, which could lead to referrals through the network. I think having various connection is very important aspect for both in and out of the country.
人に聞いてみましょうかとか、そういう意味合いでこういろんなつながりがあるっていうのは、それは、国内に関しても国外に対しても非常に重要な側面があるんじゃないかなと思います。
向こうに行って
If your stance is to go over there and talk to them and say, I'll teach you, you may not be able to learn. We can only capture the value of what the counterpart is doing when we are humble about the fact that we are not able to solve our current problems, and when we look at each other with respect, with equal status, having the altitude of learning from each other rather than teaching the other side.
というふうに思うんですね。で、
Overall, I think aging of the society and the increase in dementia are not confined to a single country, but is a large issue that the entire world faces. Various people in different positions and environments are trying things out. By sharing various success and failures, a better future can be realized in a shorter distance and in a better way.
共有していくことで、きっとそのより良い未来がより短い距離でより良い形で実現するんじゃないかと私は思っていますし、
In this sense, there are many who don't feel the necessity to go abroad, especially in the medical and nursing care fields, because their work is domestic. But there are surely things you won't understand unless you interact with others, so it is very important to visit other countries and see the outside world. I think the future of Japan may be a frog in a well who is only concerned with cleaning his well, and the temperature of the well gradually rises and becomes a boiled frog. This could be the future of Japan. We should broaden our horizon, have exchanges in the larger arena while we still can. There is definitely value to be created by interacting with each other.